Hello, everyone. This is Dr. Chris Link from the Integrative Medicine Clinic, and I'm going to talk to you today about the importance of omega-3s for health. They have many, many benefits. They reduce the risk of heart disease, reduce inflammation, and lower autoimmune diseases. They improve mood and attention, decrease the risk of Alzheimer's. They protect our vision, and they can even help us live longer and healthier. There are three important omega-3s, ALA, and ALA comes from things like flax seeds and walnuts, and they're certainly a part of a good, healthy diet. But the most important omega-3s are the long-chain fatty acid omega-3s called EPA and DHA that come from fish. Again, all of these omega-3s have health benefits. The omega-3s from fish oil have amazing benefits for multiple different organ systems in the body. Over the next few minutes, I will share some of the most important studies over the last few years showing how omega-3s can improve our health. This was a very important trial in the journal Circulation in October of 2021. This is the VITAL trial. And it used omega-3s over a period of years and found the folks that took omega-3s or had higher omega-3 levels in the blood actually had a 28% decrease in myocardial infarction over the time frame of this study. Very important. And in particular, the high EPA omega-3 was most effective at both reducing triglycerides, an important fat in the blood, and also reducing heart attacks. The key to this study was to eat more fish. And for many people, if you're not taking or eating fish, to take omega-3s. This study looked at the way that omega-3s and vitamin D reduce the risk of autoimmune diseases, things like psoriasis, rheumatoid arthritis, inflammatory bowel disease, Hashimoto's thyroiditis, and other autoimmune diseases. They gave patients 1,000 milligrams of an omega-3 daily and 2,000 international units of vitamin D, and then followed them for 5.3 years. The patients that were taking these two supplements had a 30% decrease in new onset autoimmune disease. Very important study. In fact, the author said that the clinical importance of these results are very high. Omega-3s are well tolerated, they're safe, and there are no known other effective ways to lower the onset or new onset of autoimmune diseases. So this is another important reason that omega-3s can improve our health. This is a study about omega-3s and depression in one of the most important journals in medicine, Nature. We know that about 30% of patients with depression will be resistant to standard antidepressant medications. We also know that inflammation is one of the underlying causes of depression. Thankfully, the omega-3s are both neuroprotective and they lower inflammation. And in this study, they showed antidepressant effects and anti-inflammatory effects, and generally a good outcome in patients who had depression, at least supported their overall conditions. Now, this was a fabulous study in the American Journal of Clinical Nutrition that found that patients who had the highest level of omega-3s in their blood actually lived about 5 years longer. These days, we can test the amount of omega-3s in the person's blood and body by looking at the red blood cell membrane omega-3 index, something we do often in the clinic, and it's very helpful. For people who had the standard levels in the range of 2 to 4 omega-3 index, they didn't generally do as well as the patients that had a level of 8. This is typical in countries like Japan that eat a lot of seafood, and that patients who eat seafood often or take omega-3s. We know that smoking decreases life expectancy by about 4.7 years. Omega-3s increase life expectancy by about 5 years. So knowing a person's omega-3 index is just as important as knowing a person's cholesterol or blood pressure or whether they smoke in regard to their underlying risk of heart disease. This was a fabulous study. In summary, omega-3s have many, many health benefits. They're terrific for our heart, our brain, our eyes, the immune system, inflammation. We should try to eat a couple of servings of fish, cold water fish weekly, things like salmon, sardines, mackerel, anchovies, halibut, sea bass, or cod. And if you're prone to inflammatory diseases, heart disease, brain health diseases, mood-related diseases, add 1 or 2 grams of a high-quality omega-3 capsule daily. It's important to get a great quality one. 10% of these in recent studies have been shown to be rancid. That means they've gone bad. They typically will have more of that fishy smell. They're no longer beneficial for us. Some even have heavy metals like mercury. So it's important to get a good quality product, a professional product, or one with a GMP logo, a good manufacturing practices logo on the bottle or the jar of these omega-3s. Again, this is Dr. Chris Ling from the Integrated Medicine Clinic, wishing you the very best in health and letting you know that omega-3s can improve that health along the way.